Welcome to Parenting with Purpose. Today we're diving into an important topic, how childhood trauma can lead to addiction later in life. The effects of early trauma often go far beyond childhood, deeply impacting a person's mental health, behavior, and well-being in adulthood. Many people turn to addiction as a way to cope with emotional pain that traces back to traumatic experiences. This video will cover the connection between childhood trauma and addiction, including the psychological, emotional, and neurological pathways involved. We'll also discuss ways to address and heal from trauma to break the cycle. If you're new here or haven't subscribed, please subscribe and hit the notification bell so you don't miss any of our videos on mental health, childhood development, and personal growth. To understand how trauma leads to addiction, we first need to understand what childhood trauma is. Childhood trauma refers to any adverse experience that a child finds overwhelming and that disrupts their sense of safety or stability. Common sources include physical or emotional abuse, neglect, witnessing violence, losing a parent, or growing up in an unstable or abusive environment. When children experience trauma, their brains and bodies react in ways that affect their emotional regulation, stress responses, and coping mechanisms. Trauma isn't just a memory or event, it becomes embedded in the body and mind, often shaping how the individual perceives themselves and the world around them. This can lay the foundation for coping mechanisms that manifest as addiction later in life. Trauma impacts the brain in ways that can make an individual more vulnerable to addiction. Early traumatic experiences can disrupt the normal development of brain areas responsible for stress regulation, emotional processing, and decision-making. One of the most affected regions is the amygdala, which is responsible for processing emotions, especially fear and stress. In individuals who experience childhood trauma, the amygdala can become hyperactive, leading to increased anxiety and difficulty managing stress. As a result, they may turn to substances or addictive behaviors to numb or cope with these heightened emotions. The prefrontal cortex, responsible for impulse control and decision-making, is also impacted by trauma. Trauma can delay the development of this area, which can lead to challenges in making healthy choices, resisting impulsive behaviors, and managing cravings. Together, these changes make it more challenging for someone with a history of trauma to resist the allure of addictive behaviors. The emotional impact of childhood trauma also plays a significant role in addiction vulnerability. Trauma survivors often experience intense feelings of shame, guilt, low self-worth, and difficulty trusting others. These emotional scars make them more prone to depression, anxiety, and feelings of isolation, all of which are linked to addiction risk. To cope with emotional pain, many turn to substances or addictive behaviors as a way to self-medicate. Alcohol, drugs, food, gambling, or even excessive gaming can provide temporary relief, but the underlying pain remains. Over time, what started as a coping mechanism can spiral into addiction, creating a cycle that reinforces both the trauma and the dependence on substances. For instance, someone who grew up in an abusive environment might develop an addiction as a way to escape or numb their unresolved trauma. Without healthy ways to process these painful feelings, addiction becomes an attempt to fill that emotional void. People who experience childhood trauma often live with chronic stress, as their bodies are conditioned to stay in a heightened state of alert due to the unpredictable nature of their early environment. This chronic stress triggers a cascade of stress hormones, particularly cortisol, which can create long-term changes in how the body and brain respond to stress. Because the brain becomes conditioned to function under constant stress, it eventually seeks relief, and substances provide that temporary relief. In fact, many substances like alcohol and opioids directly interact with the brain's stress pathways, reducing cortisol levels and promoting feelings of calm and euphoria. This powerful effect makes substances especially attractive to trauma survivors, as they finally feel some respite from the tension they live with daily. However, these substances create a dependency that over time exacerbates the very stress they were trying to escape. The cycle of stress and addiction becomes self-reinforcing, making it increasingly difficult for the individual to break free. It's crucial to recognize the signs of addiction, particularly in individuals with a history of trauma. Often addiction can manifest subtly at first, as the person may use substances or behaviors to take the edge off or relax after a long day. However, as they start relying more on this form of relief, the addiction can become entrenched. Signs of addiction might include increased tolerance, using more of the substance or behavior over time to achieve the same effect, withdrawal symptoms when not engaging in the addiction, and neglecting personal or professional responsibilities. Recognizing these signs early and understanding that trauma can be a root cause is essential for effective intervention and treatment. By understanding these warning signs, friends, family members, and healthcare providers can better support trauma survivors before the addiction becomes too overwhelming. Breaking the cycle of trauma and addiction often requires a multifaceted approach, combining therapy, support systems, and coping strategies. Therapy, particularly trauma-informed therapy, is one of the most effective ways to address both trauma and addiction. Trauma-informed therapy, such as EMDR, eye movement desensitization and reprocessing, or CBT, cognitive behavioral therapy, helps individuals process their trauma safely, allowing them to release the hold these experiences have on their mental and emotional health. Addressing trauma directly can reduce the need for substances as a coping mechanism, giving them tools to deal with stress, pain, and negative thoughts in healthier ways. Support groups and peer networks are also invaluable as they offer individuals a sense of community, belonging, and understanding. Many find that connecting with others who have shared similar struggles allows them to feel validated and less alone, which can make a huge difference in their recovery journey. One of the most critical steps in breaking the cycle of addiction is developing healthy coping mechanisms. Trauma survivors often turn to substances because they lack other ways to manage their pain and stress. By learning alternative methods, they can begin to build resilience and self-compassion. Here are a few healthy coping strategies. Mindfulness and meditation. Mindfulness practices help trauma survivors stay grounded in the present moment, reducing anxiety and emotional triggers. Physical activity exercise releases endorphins, which can naturally improve mood and provide relief from stress without the need for substances. Creative expression. Art, music, writing, and other forms of creative expression allow individuals to process difficult emotions in a safe, constructive way. Connecting with others. Building supportive relationships can help trauma survivors feel less isolated, giving them the support they need to heal and grow. These practices offer relief and resilience without the negative effects of addiction, helping individuals to build a fulfilling life beyond trauma. In closing, understanding how childhood trauma leads to addiction gives us insight into the challenges that trauma survivors face. Addiction often begins as a coping mechanism, a way to escape pain and feel a sense of relief. However, recognizing the root cause of addiction allows us to focus on healing rather than judgment. Breaking the cycle of trauma and addiction is challenging, but with the right support, therapy, and healthy coping mechanisms, recovery is possible. Healing is a journey, one that takes patience, self-compassion, and support from loved ones and professionals alike. Thank you so much for watching. If you found this video insightful, please subscribe to Parenting with Purpose and hit the notification bell to stay updated on our mental health and parenting content. And if you have any thoughts or experiences on this topic, feel free to leave a comment below. We'd love to hear from you and support each other. Until next time, remember that healing is always possible and you're not alone.